I got to sit up straight. I do.
Well, good afternoon. This is BJ Murphy, publisher of Neuse.com, and we have we're bringing you again today another live chat with some of our local leaders and officials in our community. And today we are joined by Representative Chris Humphrey, who represents a little bit of Pitt County and all of Lenore. Is that correct?
That's correct. Yeah.
And Dr. Pradeep, who is a physician or doctor here in our community. Both of these gentlemen are well respected in their practices in their fields, and there's been a lot of questions certainly over the past week, a lot of uncertainty, some panic, a lot of guidance from officials. And our goal here at Neuse was simply just to try to bring some officials together to give you some more guidance on what they're seeing happening and how you can better protect your family and your business, and what is happening, and maybe give you a little bit of guidance. So, gentlemen, thank you both for being here today.
Thank you.
Thanks for having me.
Now, I'll start with you, Representative Humphrey. Have you had a chance to get on a conference call today or the last day or two to find out what's happening at the state level with the cases?
Yeah, I mean, things are moving not as fast maybe as we'd like for them to, but there is some information coming down regarding questions from small business owners about help and assistance, unemployment benefits, and that sort of thing. So I can dig a little deeper on that at
Go
the
right ahead.
current time. Yeah. But you know, the governor's request for small business loans has been approved, and I just recommend you go out on Google, just Google SBA.gov, and that'll kind of tell you what you need to do to reach out and apply for those loans. I know loans aren't what small business owners want to hear this day and time.
You're a small business owner yourself.
That's correct, and we know how that goes because during the hurricanes, that's what we were offered, and you know,
right.
That's better than the alternative. So if you're small business.
Google will listen to us. Go ahead.
If your small business is suffering, you know, a short-term loan or long-term loan may be the way to go. It's better than shutting down your business.
Yeah. What are most of those loans typically designed for?
Well, they're probably going to be small loans, $25,000 or less, but I don't want to get into specifics because that's fluid and it's changing. But there will be low-interest loans. I don't know what the rate will be, but that's a federal. Obviously, a federal decision.
I believe I saw somewhere they're capped about 3.75.
I think I saw that as well. So that is a tool to use instead of filing bankruptcy. You know, if your small business suffers like many are right now.
Right.
The unemployment benefits in North Carolina, there's about a $3 billion savings there, or savings account that's earmarked for unemployment benefits, and now you don't have to walk into the unemployment office physically. You can actually apply online. So, and if your job has been affected by Corona, then my recommendation is to apply online. I mean, if you're not sure, apply online, and they'll tell you if you qualify. And in most cases nowadays, I mean, I don't see why you won't qualify, but you got to make sure you apply. Otherwise,
it basically this for the whole state of North Carolina. There's not any tiers. It's the whole state.
That's correct. And you know, the benefits, instead of waiting more than a week, 2 or 3 weeks, I think now it's a week. You should begin seeing benefits paid. So those are the two key areas. Now, there's a lot of small businesses have reached out about, you know, if they can serve food on the sidewalk.
Yeah, let's talk more about that in just a second. I want to bring Doctor in. You know, Dr. Pradeep, you've well-known, respected physician here, and over the last few days, a number of people have even brought to our attention as to some of the things you've studied about the coronavirus, especially as it relates to trends and looking at the statistics. So tell us about that and what you're seeing happening.
So the first case in the United States was on January 20th. Then on February 15th, we had 15 cases. Then it kept multiplying, and by March 4th, it started doubling every 3 days. And so if you look at my thing on Facebook, all I did was multiplied every 2 times, okay? So if the last 3 days, if you looked at it, it was supposed to be 9,326. We are already at 9,400 cases. In the next 3 days, if it doubles, it's going to go to 18,000. And 3 days after, it's going to go to 36,000. So if you go like that, by around April 15th, I think it's around 4.5 million people will be affected. Okay, so the only way to stop that would be by social distancing. Okay,
Right.
now before. A month ago, 2 months ago, I didn't even know what social distancing was. Okay, so but turns out it's been there for a long time. In 1918, when they had the pandemic, the Spanish flu pandemic, that's where we learned all this from. Two cities in the United States. If you compare St. Louis and Philadelphia, in Philadelphia, what they said is we're going to let everything fly. We're not going to do anything. We're going to let people do everything they want. St. Louis said, hell no, we're going to stop everything. Okay, so then you compare the graphs of both of them of people dying. Philadelphia had a spike and went down, while St. Louis was a flat curve. Now, social distancing is not about you. It is about the spread. Okay, it does not. All it is doing is, when it flattens the curve, it gives the healthcare workers enough time. If you spike, for example, this area, Lenore County has, let's say, 200 cases. UNC Lenore is not going to be able to handle that.
Right.
You know,
They've got just under 300 beds.
Exactly. So, and then not just 300 beds, not enough staff for the 300
Right,
beds.
that's right.
So what would happen is, at that time, we would have to decide whether we put this 80-year-old on the ventilator or do we put the 20-year-old on the ventilator. Nobody wants to make those kind of decisions, but unfortunately, those are the decisions you will have to make. Okay. So social distancing gives you enough time to control this. And hopefully, there will be some medicines or vaccines to come in the future. So the whole point of social distancing is to make sure that the healthcare complex does not get overwhelmed.
So
okay?
the numbers that you talked about a while ago, that was assuming that there is no major change. And what I'm hearing, if I'm hearing you correctly, just by practicing something as simple as social distancing, you affect the rate of that spike.
Yes. So the virus, what we call the reproduction number, it's 2.4. That means if you get the virus today, there is a chance of you spreading it to 2.5 people. Okay, if you reduce it down to less than 1.5 or 2, then you have a good chance of controlling the epidemic. Now, people always compare this to the H1N1, the virus.
Flu.
It was 1.4. So you can't compare this to H1N1 because one has a reproduction number that is very low. This is 2.4 or 2.6. There's no exact number for it. So what social distancing does is, if 25% of the population reduced their practiced social distancing, it would reduce this number by a lot. Okay, and that's all we are trying to do, to reduce that number so the spread does not get that far, and it does not double as quickly. Now, if it doubles every 3 days, by May 2nd, the whole United States population is going to be infected. That's 327 million people.
Right.
If you take 1% mortality, that's 3.2 million people. That's a whole lot of dead people. So I don't think it's going to get there.
State, right.
Exactly. I don't think it's going to get to that state.
Right.
Now, then the next question arises: how does this affect us? I mean, who knows? I mean, we are going through uncharted territory. Nobody knows what is going to happen.
Well, and if you're just joining us right now, this is B.J. Murphy, publisher of Neuse, and we are joined by Representative Chris Humphrey and Dr. Pradeep, just to have a conversation about coronavirus and its impact on our community. Certainly, we've already seen a lot of changes when it comes to schools and hospitals, and every time you go in the grocery store, you're looking at the meat aisle and the paper towel aisle, and you're worried about whether or not you're sneezing or coughing in line. We have gotten really anxious as a society, so we just want to have a good, honest conversation about that. Representative Humphrey, talk about the state's response. I know you actually serve in leadership in the House. Tell us about some of the conversations you're having with some other legislators.
Well, we've had a couple of conference calls this week, and basically we're talking at the state level. You've kind of got to wait and see what happens. It's not like you just got to be prepared to react quickly once you see the the damage or the effect or whatever. The federal government has another role. They need to be more reactive. We're trying to be, we're trying to react afterwards. They're trying to be more proactive, I should say. So we're trying to get information out because we need to assess what's going on because we do have funding, but we don't know how much of it we may need to use to pay unemployment benefits or, other things. I mean, we do have a rainy day fund that we'll utilize if we have to reach out to local governments and that sort of thing. So one thing that we do want to emphasize, if you do have questions about the coronavirus and where to get resources and how to get help, is to dial 211. That is a statewide call center.
Can we add that, Travis, to the ticker at the bottom? But go ahead.
Yeah, 211 is the emergency response number that you'd call if you have questions about where to get resources, how to get assistance, what's available in your local area. So that is managed by the state, and that was used during the last hurricane.
And I believe our own local United Way is part of helping to fund that operation.
They very well
I think we got
were.
a
I
release
believe
on
you're
that earlier
right.
today.
And so there's some other resources I can talk about later.
Well, there is a question because in fact everybody who's watching us on Facebook, in fact we're actually streaming to a couple other places, but feel free if you got a question, drop it in the comments here, and if we can we can get to it. But there was a question about what are testing sites for those who may believe that they have allergies or affecting them, but want to be tested just to ensure that they really aren't sick. If someone feels like they've got symptoms, is there a place they go? Do they call first? What do they do?
I would advise them to call their primary care physician first because it is still allergy season. It is still flu season. Okay,
Right.
It's still common cold season. So you're going to get all of those, and that has to be tested first before you go for your chance of infection with the COVID-19 is still low. It is going to ramp up, but it's still low. So, but you need to test all of that first, and before we do that. Okay, so how can you do it? You call the primary care physician, and they have to get approval for it too, because they have to go down through a flow chart and see if this is somebody who's at high risk. So if you're not exposed to somebody with COVID-19, if you have not had any travel history, your risk is still low. And you have to have shortness of breath, fever of more than 100.4. We just picked a random number, but if it's 100.3, is it not fever? I don't know.
I had the same question about 100 or less. I mean, what if you had 99 or 101?
Exactly.
Do you stay home or do you go?
Yeah, I mean, it's
More of a general guideline.
This is a work in progress, is
Right.
how I would say it, okay?
Right.
We don't have enough tests right now, so we have to ration it. So this is one way to ration it,
So one question we had about this is for you, Doctor, is can you catch the coronavirus from a person who is a carrier if, say, they prepare your food?
Preparing your food, that's a good question. I mean, it depends on if they touch the canister. I mean, you have to have contact with it, okay? So if they prepared your food and it is completely sterile, no, it's not possible to catch it. But they're going to hand you over a plate, and you
Right.
touch the plate. Yes, you could potentially.
Like earlier, we wiped down this entire. We even wiped down our microphones and the
Yeah.
stands in here. We wiped everything down just to
Yeah.
make sure. But I had a good conversation with Pamela Brown, our health director here in Lenore County, and she has definitely been on top of this. And I actually had a conversation with Bob Enders, the CEO of the UNC Lenore today as well. And the people reporting to Ms. Brown are also the people who are the health inspectors for the restaurants, and so they are under a lot of strict guidelines themselves as to how they handle food, which is why you were mentioned earlier, Chris, about the restaurants and the takeout. Tell us a little bit about that.
Well, there was some question about whether or not a restaurant could have outdoor seating, and that was cleared up by North Carolina DHHS office, and by saying that yes, you could have tables outside, but a server can't bring you the food. You have to physically pick it up yourself, and you can take it and sit down and eat it, but they will not
Right,
give
they're not
you-
going to come and refresh
They're
your
not going to
teeth
serve
for
you.
you.
That's right. They're not going to serve you at the table. They
Right.
may bring your takeout bag to you at the table, but you
And
can
just
eat it.
because it's outside doesn't mean anything. I mean, this is something I wanted to, because I was driving past Bee's Barbecue, and there were like 20 people on outside tables. What's the point? You know, that's not the point. You still have to have a minimum distance from each other. Yes, you can have tables outside. You can put the food there. They can pick up the food there. That's what it should be. It should not be you move the tables outside just because you're not supposed to sit inside. You know, I mean, that doesn't help. You know, again, it is not about you. It is about the spread. That is all we are trying to prevent here. You know, it's not about you. We are not worried about you as a person. We are worried about you as a society. You know.
That's a good point, because what we're seeing with the economy right now is how interdependent our economy really is. If a small business closes, then that person has to go home. That means that they're not going to be going to the grocery store or out to eat as much. And those restaurants depend on the revenue, so they can have employees, so they can buy goods, and that the truck driver that delivered those goods, and it goes on all the way back to the farm. And I mean, that is why I think the issue on the supply of masks is so important in our country right now, is because we're dependent on them coming from sources outside of our country, and that's put us in a little bit of a bind as well.
You know, every business is going to be affected. The healthcare industry, for example, I mean, you know, people are not going to be able to. My clinic, I only see emergent patients now. I don't see any routine patients, because it's not fair to bring them and put them in a